This video is about the toxicities or adverse effects of adrenocortical steroids. The toxicities of adrenocortical steroids are divided into two categories. The first category includes the adverse effects resulting from the withdrawal of corticosteroids after prolonged therapy. And the second category of adverse effects results from continued use of steroids at high doses. So first let's focus on the withdrawal of steroid therapy after prolonged use. The most frequent problem that is associated with steroid withdrawal is flare-up of the underlying disease, and this is the most frequent problem that is associated with prolonged use of steroids. Besides this, there are other severe complications of steroid withdrawal after long-term use. The most severe complication is acute adrenocortical insufficiency, and this occurs because of the suppression of hypothalamic pituitary adrenal axis, leading to sudden decrease in the release of mineralocorticoids and glucocorticoids. So this is characterized by signs and symptoms such as nausea, vomiting, abdominal pain, diarrhea, leading to hypotension. The blood glucose level is low. There can be confusion, delirium, and the patient can also go into coma. So this is a life-threatening condition, and the patient is treated with immediate administration of IV hydrocortisone, fluid replacement, and also dextrose administration to raise the blood glucose levels. The next severe complication of steroid withdrawal is a characteristic glucocorticoid withdrawal syndrome with signs and symptoms such as fever, malaise, arthralgia, myalgia, and these signs and symptoms may mimic the signs and symptoms of the underlying disease. So it is important to differentiate the signs and symptoms of adverse effects of glucocorticoids from the signs and symptoms of the underlying disease. Next, a rare clinical syndrome may occur because of sudden reduction or withdrawal of steroids, and this is known as pseudotumor cerebri, and this is characterized by raised intracranial pressure and papilledema, and this occurs because of sudden reduction or withdrawal of steroid therapy. So pseudotumor cerebri, a rare clinical syndrome which is characterized by raised intracranial pressure associated with papilledema. So these are some of the side effects that are associated with withdrawal of steroid therapy, the flare-up of the underlying disease, acute adrenocortical insufficiency, which has been discussed in detail in my earlier video, glucocorticoid withdrawal syndrome, this is a characteristic syndrome which is observed, and lastly pseudotumor cerebri, which is characterized by raised intracranial pressure and papilledema. Next we move on to the adverse effects that result from continued use of high dose of steroids. So this can cause alteration in fluid and electrolyte handling, hyperglycemia and glycosuria, increased susceptibility to infections. Behavioral changes can occur after administration of corticosteroids, osteoporosis, osteonecrosis, myopathy, cataract and glaucoma. So prolonged use of glucocorticoids can cause alteration in fluid and electrolyte handling. This can cause hypertension because of increased retention of sodium and water, and potassium loss causing hypokalemia and hypokalemic metabolic alkalosis. So hypertension and hypokalemic metabolic alkalosis can occur because of prolonged use of high dose of corticosteroids. This is particularly seen in patients with primary hyperaldosteronism occurring secondary to adrenal adenoma, a tumor of the adrenal gland causing excessive release of mineralocorticoids into the circulation. Also, patients treated with potent mineralocorticoids for a long period may experience signs and symptoms of hypertension and hypokalemic metabolic alkalosis. The second side effect of prolonged use of corticosteroids is hyperglycemia and glycosuria. It can cause precipitation of diabetes in susceptible individuals, and this occurs because of alteration in glucose metabolism due to the action of steroids. The third action of glucocorticoids is increased susceptibility to infections. There is increased risk of infections due to inhibition of the immune system, due to inhibition of the inflammatory responses. So due to inhibition of the immune system, there is increased susceptibility to infections. The next adverse effect of glucocorticoids is behavioral changes which occurs after the administration of corticosteroids, and this can cause nervousness, insomnia, mood changes and psychosis. The next adverse effect of glucocorticoids is osteoporosis, decreased bone density and increased risk of bone fractures. So this occurs because of multiple mechanisms. The first mechanism is inhibition of GI or intestinal absorption of calcium, and this causes secondary release of parathyroid hormone. The increased release of parathyroid hormone can cause resorption of the bone, leading to increased risk of fractures. Also, the bone density decreases because of decreased bone formation and increased bone resorption. So, the bone formation decreases because of the suppression of osteoblasts, and bone resorption increases because of stimulation of osteoclastic activity due to alteration in the RANK ligand. So, increased osteoclastic activity, decreased osteoblastic activity decreases the bone density, and in addition there is decreased GI absorption, decreased intestinal absorption of calcium, and also secondary increase in the parathyroid hormone levels that causes increased resorption of bone, increased risk of fractures. The common sites of fractures are ribs and vertebrae. Another adverse effects of long-term use of glucocorticoids is osteonecrosis or aseptic or avascular necrosis of the femoral head. So pain and stiffness are the earliest symptoms of this adverse effect, and this can lead to fracture, and the femoral head is the most common site for avascular necrosis due to excessive use of corticosteroids. Lastly, cataract and glaucoma are established adverse effects of glucocorticoids use for prolonged period. So this is related to the duration of therapy and high dosage of corticosteroids. Lastly, cataract and glaucoma are established adverse effects of glucocorticoid use and is related to dosage and duration of therapy. It is also important to keep in mind that the cessation of steroid therapy may not lead to resolution of the opacities that result from cataract, and despite cessation or withdrawal of steroid therapy, the cataract might progress. Therefore, monitoring is essential for patients with high doses of steroids for prolonged period. So these are the adverse effects that result from continued use of high doses of steroids. So thank you for watching. If you find my video useful, please like and subscribe to this channel.